Common anatomical medical terms for medical coding, Part 2. Adam's apple. When the larynx grows larger during puberty, it sticks out at the front of the throat. It is called Adam's apple. The main function of this Adam's apple is to protect the vocal cords. Cochlea. The cochlea is a hollow, spiral-shaped bones found in the inner ear that plays a key role in the sense of hearing and participate in the process of auditory transduction. Cornea. The cornea is a transparent part of the eye that covers the iris and the pupil and allows the light to enter inside the eye. Crystalline lens. Crystalline lens of the eye is a natural lens which produces 1/3 of the eye total optical power and focuses light into an image on the retina. Alveolar nerve. Alveolar nerve is a mandibular nerve branch which is responsible for sensory innervation to the gums, that is gingiva, on the lower jaw. Eardrum. Eardrum is also known as tympanic membrane. This tympanic membrane separates the outer ear from the middle ear. This membrane vibrates when sound waves strike it, begins the process that converts the sound wave into a nerve impulse that travels to the brain. Forehead bump. Forehead bump is a swelling that is not due to underlying diseases. Swelling under the skin called goose egg, which is usually a temporary symptom of head trauma. Forehead is quick to swell because there are so many blood vessels just under the skin surface at the forehead region. Frenulum. The tongue attaches to the floor of the mouth with a web of tissues called the frenulum. This frenulum may be shortened or thickened, restricting movements of the tongue. It is an inborn variation in the structure. Ganglion. Ganglion is a collection of neural bodies found in the voluntary and autonomic branches of the peripheral nervous system. This ganglion can be thought as synaptic relay station between neurons. The information enters the ganglia, excites the neurons in the ganglia, and then exits. Iris. Iris is a colored part of your eye, and muscles in the iris control your pupil. Iris is present in the anterior part of the eye lens. It controls the size and diameter of the pupil and thus regulates the amount of light entry into the eye. Lacrimal glands. Lacrimal glands is a bilobed oval-shaped gland with the primary function of secretion the aqueous portion of the tear. It is located at the inner corners of the eye and in the front part of the nasal wall. Nasal sinuses. The word sinus is the most commonly understood to be the paranasal sinuses that are located near the nose and connect to the nasal cavity. There are 4 types of paranasal sinuses, each corresponding with their respective bone. Ethmoid sinus. Ethmoid sinus is located inside the face, that is around the bridge of the nose. Maxillary sinus. Maxillary sinus is located around the cheeks. Frontal sinuses. Frontal sinus are located at the area of the head, that is at the forehead region. And sphenoid sinus. Sphenoid sinus is located behind the nose and between the eyes. Optical nerve. Optical nerve is a bundle of more than 1 million nerves that carry visual messages. You have one connecting the back of each eye to your brain. Damage to an optic nerve can cause vision loss, and the type of vision loss and how severe it is depends on the where the damage occurs. Tonsils. Tonsils are lymph nodes in the back of the mouth and top of the throat. These tonsils help to filter out bacteria and other germs to prevent infection in the body. Vitreous body. The vitreous body is a clear gel that fills the space between the lens and the retina of the eyeball. A vitreous body plays an important role in providing metabolic nutrient requirements of the lens, coordinating eye growth and providing support to the retina. Adrenal glands. Adrenal glands are the small triangular shaped glands located on top of both kidneys. They are also known as suprarenal glands. They produce hormones that regulate metabolism, immune system, blood pressure, and other essential functions. Aorta. Aorta is a main artery that carries blood away from your heart to the rest of your body parts. The blood leaves the heart through aortic valve, then it travels through the aorta to deliver oxygen-rich blood to the brain, muscles, and other cells. Brainstem. Brainstem is a lower part of the brain that is connected to the spinal cord. Brainstem is responsible for regulating most of the body automatic functions that are essential for life. These includes breathing, heartbeat, etc. Bronchi. Bronchi are the large tubes that connect to your trachea and direct the air you breathe to right and left lungs. This bronchi is located in the mediastinum at the level of the fifth thoracic vertebrae, and the bronchi branches into a smaller passageway until they terminate in a tiny air sacs called alveoli. Capillaries. Capillaries are delicate blood vessels that exist throughout your body. These capillaries transport blood, nutrients, and oxygen to the cells in your organs and body systems. Cerebellum. Cerebellum is a structure that is located at the back of the brain, underlying the occipital and temporal lobes of the cerebral cortex. Diaphragm. Diaphragm is located below the lungs, is a major muscle of respiration. It is a larger dome-shaped muscle that contracts rhythmically and continually, and most of the time involuntarily upon inhalation. The diaphragm contracts and flattens the chest cavity, enlarges. Inferior vena cava. The inferior vena cava is a large blood vessel responsible for transporting deoxygenated blood from lower extremities and abdomen back to the right atrium of the heart. Mesentery. Mesentery is a fold of membrane that attaches the intestine to the abdominal wall and holds it in place. Mesentery prevents it from collapsing down into your pelvic area. Pericardium. Pericardium is a fibrous sac that encloses the heart and great vessels. This pericardium keeps the heart in a stable location in the mediastinum and also facilitates its movements and separates it from the lungs and other mediastinal structures. The pericardium also supports physiological cardiac functions. Peritoneum. Peritoneum is a tissue that lines your abdominal wall and covers most of the organs in your abdomen. A liquid called peritoneal fluid lubricates the surface of tissues. Pleura. Pleura is a thin layer of tissue that covers the lungs and lines the interior wall of the chest cavity. It protects and cushions the lungs, and the tissue secretes a small amount of fluid that acts as a lubricant, allowing the lungs to move smoothly in the chest cavity while breathing. Spleen. Spleen is a fist-sized organ in the upper left side of your abdomen, that is next to your stomach and behind the left ribs. Spleen's main function is to filter the blood and helps defend the body against pathogens. Pathogens are nothing but the disease-causing organisms. And it is possible to live without spleen, as the liver takes over the functions of spleen. Ureters. The ureters are bilateral, thin, tubular structures that connect the kidney to the urinary bladder. These ureters transport urine from the renal pelvis into the bladder. The muscular layers are responsible for the peristaltic activity that the ureters use to move the urine from kidneys to the bladder. Urethral meatus. Urethral meatus is slightly ventral to the tip of the penis. Once the bladder becomes full, urine flows through the urethra and leaves the body at the urethral meatus, which is located at the tip of the penis. The urethra is more than just a urinary duct. It also serves as a conduit for semen and sperms. Clavicle. Clavicle is also known as a collarbone. It is a thin, long, slightly curved bone that connects your arm to your body. It sits below your neck and is a part of the front of your shoulder. This bone connects your sternum in the middle of your rib cage to your shoulder blade, that is scapula. Coccyx. The coccyx is a triangular bone that consists of 3 to 5 fused segments, the largest of which articulates with the lowest sacral segment. Mandible. Mandible is the largest bone in the human skull. It holds the lower teeth in place. It assists in mastication and forms the lower jawline. The mandible is composed of the body and the ramus and is located inferior to the maxilla. The body is a horizontally curved portion that creates the lower jawline. Manubrium. Manubrium is an anatomical process or a part. It is shaped like a handle. The uppermost segment of the sternum of humans and many other mammals, that is somewhat triangular flattened bone with anterolateral borders which articulate with the clavicle. Bone marrow. Bone marrow is found in the center of most bones and have many blood vessels. There are 2 types of bone marrows, red and yellow. Red bone marrow contains blood stem cells that can become red blood cells, white blood cells and platelets. Yellow bone marrow is mostly of fat. This bone marrow is full of collagen, which improves the health and strength of bones as well as skin. It is also rich in glucosamine, a compound that helps against osteoarthritis and relieves joint pain and reduces inflammation in the joints. Mastoid process. Mastoid process is the smooth pyramidal or a cone-shaped bone projection at the base of the skull on each side of the head, that is just below and behind the ear in humans. And the main function of the mastoid process is to provide an area of attachment of several important muscles in the head. For instance, it is the attachment site of certain muscles of the neck. Patella. The patella is the largest sesamoid bone in the human body and is located anterior to knee joint within the tendon and the quadriceps femoris muscles. It is also known as kneecap. It is a flat, rounded, triangular bone which articulates with the femur, that is the thigh bone, and covers and protects the anterior articular surface of the knee joint. Scapula. The scapula is also known as the shoulder bone, which is a large triangular shaped bone that lies in the upper back. The bone is surrounded and supported by a complex system of muscles that work together to help your arm to move. And the scapula is an important bone in the functions of the shoulder joint. It engages in 6 types of motions which allow for full functional upper extremity movements, including protraction, retraction, elevation, depression, upward rotation and downward rotation. Skull. The bones that forms the head is called a skull, and the skull is made up of the cranial bones and facial bones. Cranial bones are surrounded and protected the brain, and the facial bones that forms the eye sockets, nose, cheeks, jaw and other parts of the face. And an opening at the base of the skull is where the spinal cord connects to the brain. And the skull is a bone protective cavity for the brain. And the skull is composed of 2 parts, the cranium and the mandible. Spinal cord. The spinal cord is a long tube-like band of tissue. It connects your brain to your lower back. Your spinal cord carries nerve signals from your brain to your body and vice versa. These nerve signals help you feel sensation and move your body, and any damage to your spinal cord can affect your movement or function. The brain and spinal cord are your body's central nervous system, and the brain is the command center for your body, and the spinal cord is the pathway for messages sent by the brain to the body and forms the body of the brain. Sternum. The sternum is a partially T-shaped vertical bone that forms the anterior portion of the chest wall. The sternum is divided automatically into 3 segments: manubrium, body and xiphoid process. The sternum connects the ribs via the costal cartilage, forming the anterior rib cage.